Hello, my name is Dr. Vera von Bodungen, and first of all I would like to thank the ikoo team for the invitation to answer their questions or the questions of their followers they had on the topic of breast cancer. It feels like a little pebble stone under your skin. It is very hard and it's not possible to move it around. In general, you should go and see your gynecologist because they are the ones who take care of this topic. But if there's no gynecologist around, just go and see any doctor you know. Maybe your general practitioner can also help you. And in other countries, it might be a surgeon who can help you, but the most important thing is to see a doctor at all. Yes, there are many different kinds of breast cancer, and scientists have done a lot of research on this topic, and we have, for example, hormone-sensitive kinds of breast cancer, we have not hormonal sensitive kinds of breast cancer, and as a lot of money has been put into the research on breast cancer treatment, we do have a very individual treatment for those different kinds of breast cancer. Very good question. You can never be too young to start screening for breast cancer. There are different kinds of screening, and the first thing that every woman or young girl should start is to try to palpate their breasts themselves, and therefore, as I just said, you can never be too young for this. And then we have different diagnostic instruments that can screen for breast cancer. It's on the one hand, it's the ultrasound, and on the other hand, it's mammography or an MRI. I would say if you have no family risk for breast cancer, you should start at the age of 40 at least to screen with radiological help, means mammography or ultrasound to screen your breast. So it's difficult to answer it in general because we don't have a one therapy fits all patients therapy, as we do have very difficult kinds of breast cancer. In general, we have a systemic therapy which could include chemotherapy, but it can also include an antibody therapy. It could be tablets you're swallowing which are anti-hormonal, and then we have the surgery, of course, and we do have radiation of the breast. No, unfortunately, in most cases, it's not the end of the treatment. Luckily, we do have a treatment that prevents getting it again. So you can protect yourself by taking an anti-hormonal treatment to get it again. And so the treatment is finished. If you have a breast cancer that fits for this therapy, it's finished after 5 or even after 10 years. Well, it depends on the size of the tumor you have. If you have a very small one, you don't have to take much of the breast. But if you have quite a big widespread tumor, which is 6 to 7 centimeters, it could happen that the whole breast tissue had to be removed in order to have the safety margins all very safe and to avoid getting it again. No, unfortunately not, and this is why we are happy to raise the awareness of breast cancer to women, because unfortunately there are cases where you can't feel anything and you feel safe and you go and see your gynecologist and they do the examination and they say we also can't feel anything, and therefore we have those screenings which in Germany take place from the age of 50 till the age of 70, where all women are invited to go to a mammography and have and have a picture taken of their breast where some things that can't be felt or touched can be seen at. No, not in every kind of breast cancer chemotherapy is part of the treatment. Some women are lucky, or actually it's quite a lot of women who are lucky, who have a hormone-sensitive breast cancer, and they do not always have to undergo chemotherapy. They are fine with surgery, radiation, and then anti-hormonal treatment. Every surgery has a risk of bleeding or infection, but those are general risks you take into consideration when you do a surgery. But in general, the surgery on the breast is a very safe surgery, and if you do not have to take the whole breast tissue away, and if you do not have to do a whole reconstruction of the breast, then it's quite a safe kind of surgery. After surgery, there will be a couple of days, and if you had a very complex kind of surgery, it might be 2 to 3 weeks, but this means that you had a full breast reconstructional surgery. And after chemotherapy, it depends. There's a lot that patients can do on their own to accelerate the recovery and to make everything get back to normal faster, including sports, if you're possible to do it after this therapy, including looking at what you're eating, try to have healthy foods, try to look at yourself and listen to your body, and if you try to look at those points I just mentioned, then the recovery might be much faster than... No, not always. Sometimes they do hurt, but it's very rarely that it hurts. And if I see women in my practice and they say, oh, it really hurts at my breast, for me it's more a relaxing thing if I hear there's pain. But sometimes the cancer can also be related to pain. There's never too often, actually. But ideally, you check yourself once a month. And if you're still having a cycle and you have a period, then you should definitely check after you had your period, after the bleeding, because due to hormones, the breast can be more lumpy before you have the period than it is after you had it. Then it's more soft and it's easier to feel any changes. So ideally, you do it once a month, probably when you're under the shower and you have the shampoo or whatever, and then you can feel your breasts. If you only do it 4 times a year, also good, but just do it and don't be afraid of it.